Hello, I'm Dr. Anita Kumar. I'm a lymphoma specialist at Memorial Sloan Kettering Cancer Center. After finishing initial treatment for diffuse large B-cell lymphoma, we usually monitor our patients using CT scans and a physical exam. We are interested in finding better ways to detect if the cancer comes back after completing initial treatment. In this study, we're evaluating a new technique called minimal residual disease, or MRD, assessment. With this technique, we use very sensitive genetic technology to see if we can find very small amounts of lymphoma cells circulating in your bloodstream. This technology is designed to detect one lymphoma cell among 1 million white blood cells. The MRD assessment is a simple blood test. We want to see if MRD assessment is more, less, or equally as accurate as CT scans for detecting if your lymphoma comes back. We also want to determine if MRD assessment can identify lymphoma relapse sooner than CT scanning and a physical exam. If you participate in this study, you'll have additional MRD blood tests that we obtain at the same time as other routine blood tests that your oncologist requests at every follow-up visit. The study schedule is the same surveillance schedule you would otherwise follow with your oncologist. It involves clinical visits with blood tests every 3 months and CT scans every 6 months for the first 2 years after you finish your initial treatment. There are certain criteria for you to be in this study. You need to be planning to receive, currently receiving, or have recently completed your first regimen of chemotherapy for diffuse large B-cell lymphoma. And you need to be age 18 or older. We hope that the MRD assessment tool we're evaluating in this study turns out to be as good as or better than CT scans for detecting lymphoma relapse. If so, we may be able to eliminate the use of follow-up CT scans and replace them with a simple blood test to detect MRD. In addition, if the MRD assessment tool detects lymphoma relapse earlier than clinical evaluation or CT, we may test whether it is beneficial to treat patients sooner. If you're interested in knowing more about this study, please speak with your treating oncologist or contact my office at 212-639-2668. Thank you for your interest.